Maryland Governor Larry Hogan is joining us live from the Government House in Annapolis right now. Governor, thanks so much for being here, giving us your time. We know how busy you are.
Sure.
It's our understanding you got a big update for us tonight. What's that?
Well, there are a lot of things going on in our state that we can talk about tonight, but just before we went on the air, I think you're the first ones to hear about it. We just got SBA designations for the state of Maryland so that we can immediately try to help start helping some of the small businesses that are being impacted by this. But we made a number of important announcements today. Took some additional steps to try to continue to work on this social distancing. Unfortunately, we reported yesterday we had our first death in Maryland, and our numbers are continuing to rise. And sadly, we have our first child that was found to have the coronavirus, a 5-year-old, and so that changes the situation a little bit. But we took some steps to try to, we lowered the number of people that should be gathering together. We took steps to keep people at BWI from only ticketed passengers and people that have to have an employee badge that can come to work, and we don't want the airports crowded with people that aren't traveling. And we've made some further announcements about trying to keep people off of all of our transit systems and the metro if they're not essential workers, and if it's not really important that they travel. We ought to try to stay off of those systems, and for as much as possible, we want people to stay home.
Yeah.
Governor, you've had to share some pretty sobering news with all of us over the past few weeks, and telling us about a 5-year-old girl who tested positive in the county was certainly among that. You talked about the need for people to change behavior. You talked about how some people are still having play dates and still having some of these large social gatherings. I could tell it was bothering you quite a bit. Is there any correlation that we know yet between the diagnosis of this child and whether there was a play date or a social gathering? What do we know about this?
We don't know the exact details of that yet, but yeah, it has bothered me because all of our cases now, originally when this outbreak first occurred, and we've been on this for about a month, and we've been in a state of emergency for 15, 16 days now. Last Thursday, we closed all the state schools, and every day we're taking big actions. But we keep telling people that how important this is to not spread this virus, so we can, bend this curve down, so we don't have hundreds of thousands of people infected, and we don't have thousands of deaths in our state. But some people just weren't listening, and so last weekend we had just thousands of people partying in bars for St. Patrick's Day weekend. We had to shut all the bars and restaurants down, and now we've got everybody out of school. And we got a lot of parents who are not essential workers who are not reporting to work, but instead of staying home and in place like we've been advising repeatedly, many people are doing a great job of that. But some people are out, gathering in large gatherings and having, pretending like they're on vacation and it's spring break, and they're having big groups of people like at some of our parks, having cookouts in pavilions. And, it was kind of a stern warning, and it's simply because we're telling people that if you're doing that, you're actually in violation of state law, and you're endangering the lives of your fellow citizens. I mean, that's how serious this is.
Yeah, Governor, I wanted to ask you about young people specifically, but I mean, after listening to you just now, it's not just young people, it's a lot of people that are doing this. Let me move on and ask you about the number of federal workers who are showing up in these offices in crowded conditions because they have to. They have not been given permission or instructions to telework. What do you make of that?
Well, so last week we instituted mandatory telework for all of the state employees who are on a list of those who can. There's still an awful lot of people who are not able to telework, so there's still a big chunk of the workforce that is still reporting here in Maryland. The federal government took those steps earlier this week, and a lot of people are doing teleworking in the federal government, but you're right, there's still far too many people that are reporting, and I think it may be something that the federal government addresses, and it's something that we're going to continue to work on. I know that a lot of people in a lot of jobs have to get to work, and we need them to, because they're important jobs, not just the nurses and the doctors and the police officers and those folks, but the people that are trying to make sure everybody gets fed, and the people working in the grocery stores and in the supply chain. They're all critical.
Governor, is it at the point
there are some folks that really should stay home?
Yeah. Is it at the point where
perhaps don't have to report to work?
Is it at the point where perhaps you should make a telephone call to the White House? Have you talked to the president about this?
Just this afternoon I had a call with the president and the vice president and all of the nation's governors. We had 52 governors, including a couple from the territories, and we addressed a lot of these points. And look, we're all working together in this fight. It's going to take the federal, state, and local governments working together. And it really, the message I want to give tonight to the folks watching is that it really is going to take every one of us. All the citizens have to be a part of this, because we're not going to be able to stop this crisis unless everybody pulls together. And we're all in this together, and it really makes a difference.
I wonder, and I've got a question for you about supplies, but to the point that you just said, there's hasn't been a time in recent years where our collective health is more dependent on what each of us does. What is it going to take to get through to people so that they understand that what I do impacts you, Governor, what you do impacts me, what we do wherever we are, that we're all interconnected?
Yeah, well, thank you. I mean, I think you play an important role in that, because as people are now watching the news and they're starting to take it more seriously, obviously some of the things that we've had to do are very disruptive to people's lives, and it's not something we do lightly, and it's scary, and it's going to hurt people economically. We wouldn't do it if we didn't think it was going to actually, save the lives of thousands of people. And people are now, I think, starting to get more serious. Not everyone. Most people are being very cooperative. A lot of the streets are empty. A lot of people are staying home when they can, and they're listening, and they're watching the news, and they're getting more informed. It's just a few people who just still need to get the message, so you can help us with that, and I appreciate having the opportunity to talk to your viewers.
Last question for you, Governor. I know you're the president of the National Governors Association. You're on the phone with them quite a bit. The president today said it is up to the governors to get supplies to the states. So can you tell us, where does Maryland stand on access to tests, access to ventilators? A lot of people are wondering, what's the process? Can my doctor give me a letter? Do I go to the pull-up testing site? How do people receive these tests? What's the status on the access to tests in the state of Maryland?
Yeah, so it's something that everybody is working very hard at every level to try to increase the number of tests. There's no state in America that has an adequate number of tests, including Maryland. But we were one of the first states in the country to get approval to do our own test. Some of our private labs and Johns Hopkins University and other people are just a big part of this. There are big private labs that are a part of it. The federal government is doing their best to try to push these things out to the states. It's one of the top priorities that all the governors talked with the president and vice president about today, and it's something that everybody's trying to get to, because testing is a big issue, but also these personal protective equipment and the ventilators and things like that are all in short supply, which is one of the reasons why they're taking such unprecedented action at the federal level to ramp up production of these things and get big industries involved in trying to push these things out to the states as well. And we're trying to take our own steps at the state level. So we've ramped up considerably, and as the testing increases, that's when you see these numbers start to rise. It's really about the fact that more people are getting tested and we're seeing the numbers climb. But it's still a work in progress at every level, and everybody's working hard to try to get more tests out there.
Maryland Governor Larry Hogan, we'd like to thank you for your time, and hopefully you're taking care of yourself. We know you're a fellow cancer survivor,
right.
So hopefully you're taking care of yourself out there, too.
Thank you, Bruce.
And pass on our gratitude.
Very much.
Pass on our gratitude, Governor, to everybody who is essential, who is working on your team to make this happen and to keep Marylanders safe. We are all grateful.
Governor, thanks
thank you so much. There's a wonderful group of people working around the clock to try to keep people safe, and a lot of people stepping up, so thank you.
Okay. Thanks, Governor.